I think that in a sense was groping in various aspects of medical science and medical work, and always doing things that I was particularly interested in doing at the time, but eventually channeling back into pediatrics, and in essence getting a lift up from what was a senior house officer post in pediatrics at Queen Mary's Hospital for Children to a lectureship in Sheffield with total responsibility for running a ward and setting up my own sort of clinics and research interests in 1960. And then of course I gradually concentrated on a career in pediatrics, but also specifically in relation to neurology and in particular in relation to muscle disease. And I think the sort of combined experience of working in a lab and doing basic research in human and animal muscle, and then working in a clinic and having direct contact with the patients, which I always enjoyed, really gave me a very much broader perspective in a sense of the disease from both research and clinical point of view. And in fact it was my policy for many years, particularly over the period we were at the Hammersmith, where we also had a very active research team, to tell the people from the lab that they were always welcome to come to the clinic, come and sit in with us and see the patients. And when they thought it was perhaps embarrassing for the patients, I told them not to worry, because I would always introduce them, and I'd always ask the parents' permission if it was okay for our research team to also come and join us. And there was never an occasion that the parents didn't welcome them in a sense. So this integration, I think, of the basic laboratory with the clinical, and also the integration of the clinical with caring for the family, because this was a pediatric approach. The neurologist was saying in those days that there's nothing much one can do, make the child comfortable, and then they discharge them from any follow-up care, whereas my approach was the opposite. There's always something you can do to help a family, however serious or however severe a problem is, and it's more important to maintain contact and to see these children on a regular basis than to just dismiss them. And of course that's the way I was taught actually from the patients about many of the diseases. So it was also a educational process for me.